East End or West Side?
I'm a West Side person through and through. I grew up in the West End, and I've pretty much lived there my whole life.
Can you tell us a bit about your research?
I lead the Ontario Drug Policy Research Network, which is essentially a group of researchers and clinicians, policymakers, and members of the general public who are really committed to generating evidence to inform policy across the country. And a particular area within that I'm really passionate about is trying to address the drug toxicity crisis that exists here in Canada, and through that work really connecting with and learning from the many people who use drugs and people who are working at the community and policy level to try and really affect change in this crisis.
And what excites you about urban and community health research here at Unity Health Toronto?
Urban and community health research is really a broad, diverse group of scientists and investigators who work across social determinants of health, health equity, Indigenous health, and trying to really shed light on and gain an understanding of how we can better serve marginalized populations like people who use drugs and people who are experiencing homelessness. So for me, what's been really neat is seeing how scientists work across these diverse areas and also work to engage and integrate the perspectives of communities and people with lived and living experience within that work, because I think it creates unique, impactful research, but also research that meets the needs of people who will be ultimately impacted by the changes that it creates. And also allows us to do all of that within this environment of diversity and shared passion for this topic, where we can really work together and learn from one another.
And what makes Unity Health a great place to do this type of research?
Unity Health has a longstanding history of serving urban and marginalized populations, both clinically and in research. An example of that is the MAP Center for Urban Health Solutions, which has a longstanding history of really being at the forefront of a lot of this work, which has allowed us to attract the best and the brightest people who are working in this field. I also really find that by working within this organization, there are groups like the Applied Health Research Center, Shing Chart, and the Knowledge Translation Program that really exist to help support researchers take those clinical questions and translate them into high quality impact that can then be communicated in a way that is really impactful and accessible for various different audiences. So having this broad expertise within urban health, as well as connecting the clinician side to the scientist side and having that support to create high quality research, I think makes Unity Health Toronto an incredible place to work.
And 10 years from now, what are some milestones you'd like to see for this pillar area?
I really hope over the coming years to continue to help connect people to one another and to grow the careers of the scientists and investigators that are working within this pillar and those who we hope to recruit over the coming decade. I think the pandemic has really been a challenging time for many reasons for so many of us, but within research, it's really been hard to connect, to find those shared interests and to forge new collaborations. And so one thing that I really want to try and do is to grow this cohesive community within the urban and community health pillar to help us find those ways to connect and to continue to conduct research that gains traction and attention at the national and international stage, while also prioritizing the continued expansion of patient and community engagement in that work and the direct connection of our research to policymakers at all levels of government.